course, it's very, very important to know that beyond the economic costs, there are also other things that come. In fact, when we did, the day we got the funding, which is bringing these places here, we had a family which was traveling 300 kilometers to come for dialysis in Kampala. So the center that has been established here, and thanks to the executive director and Sally and his team, Dr. Chibun, for bringing these units closer to the people. Because when you need life, if your kidneys fail, if you don't do dialysis, you die. So you look, people have migrated to Kampala, sold their places to come and do dialysis. Getting these regional centers is very important. Of course, even the government spends a lot. And no government actually wants to pay for dialysis. The story of America is also very interesting. In America, in order for, the only free service in America, I came from there, so I know, is actually dialysis. And when you present to the emergency unit. But to get that going, they had to dialyze a member of parliament in the chambers. And that's why dialysis is free. So as we advocate, we need to know that it's not going to be very easy. I told you about malaria and the dialysis unit. So always the planners weigh that. And so you have to advocate for kidney disease. Of course, people drop out of schools when they fall sick. And then the environmental unfriendliness of dialysis. Each session of dialysis, and so you can attest to this, uses about 200 liters of water. And after it has done its work, all that water gets dumped. Okay? This is the dialysis plant. But you have to clean that water, and that is crystal pure water. It should be free of infections. We always have to take it to the National Water and Storage Company to be able to test that there is nothing there. And then after you use those 200 liters, they come out and they have toxins and they increase the waste management. So it's a lot of labor intensive. So the best way is not to get there. Of course, I shared with you about this in the morning, but there is a lot we can do, even at community level. We've gone to the level of using community health workers to be able to screen for kidney disease. So it is not a magic bullet. We just have to make sure that we appreciate the risk factors to our setting. We should understand that, okay, diabetes, hypertension, HIV, and obesity are there, but these are the environmental toxins that exist with us. The other day we shared a case of schistosomiasis, which was quite interesting. This girl grew up in the UK. She comes here for 6 months, then begins to pass blood in urine. We send her to people. We failed to investigate. Later we found she had schisto. I don't know where she got it from. But good news, we treated her, and actually I gave her a dose of Praziquantel, and I think today she was calling me. I think she's bringing me some chickens, because she had spent 6 months with that, and she's no longer in the reproductive age, so it wasn't a cervical problem. So these unique can actually cause issues. So it is important that we use what we have. We should do task shifting, but more importantly, we need to educate the public. We need to educate the public. Whichever person comes through your hands, please make sure that you educate the public about kidney disease. But before you even educate the public, you people, the health workers, if you are 40 years and above, at least go and screen your urine. Go and do a creatinine once a year. It's very disheartening to have colleagues and you can't help them. You are not the one who brings the supplies to Chirudu, to send them to Chikundu. He has no money, Bagasha, and they can't pay. I've seen some former directors fail to buy erythropoietin. So it's very important that we take this kidney disease seriously. Because when it comes to your household, it never leaves you the same. Let's use all the platforms to ensure that we prevent kidney disease. Joseph talked about this. what the Kidney Foundation has done, and Dr. Bagash has also talked about it. Maybe what they have not talked about is that we also do some research, and the data you see there was one of the World Kidney Days, where our group, Dr. Ogava and team, actually went ahead and published the work. It is available for you to review. We looked at hypertension in people who presented to us. This is a busy slide, but I'm going to try to look at the risks and challenges and try to suggest some mitigations. So, of course, one of our problems is limited lab capacity. People think that we should have point-of-care tests. You can use a dipstick. We are trying to bring in now even a point-of-care for creatinine. That might help. Of course, there are barriers of transportation. Mobile clinics and outreaches might help that, although it's quite expensive. Some people have used vouchers to encourage people to come, especially in high-risk patients. Then there is stigma and low awareness. This one I've talked about, but it's important when people tell their stories and people appreciate, especially there's a lady who came and she had a GFR of 3, but she was able to come in very early. We dialyzed her for 5 days, and then her kidney function went back to 87. Clearly showing that we can do a lot more for kidney. Of course, there are funding gaps. We need to make sure that the government is aware. We need to tell our leaders to advocate for us because they reach in places where we can't. We also need to harness the public-private partnerships. As I told you, 70% of the health workforce in Uganda, especially in the big towns, is provided by the private sector. So we really need to engage them, and we need to apply for the budget. Then we have the workforce shortages. We need to train more people. Luckily, Dr. Bagash and the team established the dialysis nurse training, but we need to work hard that these people get employment. Because if they don't get employment, soon they will not be able to train. So we have to figure out together to see how we are going to do that. Nephrology fellowships, the International Society of Nephrology is very important. Some people have also done teleconsultations where people are able to consult over long distances, and they do help to mitigate those workforce shortages. Then the data. Without data, we can do very little. I haven't seen Dr. Kazi-Njema. Okay, she hasn't been able to come, but she's working on a data registry. So graduates, if you get to work in one of these dialysis units, we are trying to have a registry set up so that we can get data to advocate with the government. Higher pocket costs, I've talked about that, but the Kirudu Ministry of Health model has helped us very much. Dr. Chigun did not get a chance to talk about it, but you are beneficiaries, and I think you saw the joy that was expressed by the executive director because the dialysis unit is there. But you have to take care of it, you have to take care of your patients. Then, of course, we are talking about green nephrology, as Amina was talking about. So, we all have a role to play. The scientists need to collaborate and generate data. The clinicians need to support screening and the referral pathway. You had the physicians complaining that, I've assessed this patient, then I refer him, and then he gets received by an intern. Quite frustrating, eh? I saw it on their faces. I was sitting on their table. Clearly they've taken several years and they've made the diagnosis, but these are the systems. So we need to improve the referral pathways, but not only that, but also where our patients are received. In fact, for me, when I was still a young man in Nakaseke Hospital, all my patients would refuse to go to Bulago, just 60 kilometers away. And I would have to read that surgery in the community. While I'm reading, I used to give my own anesthesia and I operated people. Luckily, they all survived, over 700. But you read surgery in the community, because the guy says, you either treat me or I go home and what? And die. And he has intestinal obstruction. So, That is no longer necessary. We have moved leaps and bounds, but we need to clear that referral pathways. The communities are important. We just talked about the pollutants. Even you as an individual, as you throw out that garbage, you need to think about that impact. Then lastly, our policymakers, we increasingly learn that nothing can be done without the support of government. So you need to learn to make noise, and that's why some of us are in social media, because then at least there you push out your points, whether they are hard. Of course, some people come and tell you, we're not here. Yeah, but someone has got to do it, and we've got to protect these kidneys. So I want to thank the organizers, the people who have welcomed us here. Prevention is possible, and we can start today. Thank you very much.
Thank you very much. Summary. So, for the afternoon session, we've had 3 talks so far, and we'll take 3 burning questions to any of the 3 speakers that have spoken. Joseph Mukasa, Togasha,
Thank you again. My name is Barbara Kemekisa again, and I really want to thank the presenters. I think the third part was really more clearer to the community part, and I'd love to borrow something from the HIV world. I'm an HIV activist living with HIV. And I started awareness at the age of 22, that is 17 years back. I'm 40 now. So how we started, we didn't have a lot of involvement. We had policy issues. We had, there was a lot of stigma and discrimination. We never had a lot of representation at high-end engagements like this. But because of the few bold faces that came out and decided we want to change the face of HIV, today we see a huge number of community engagement of people living with HIV. Like I said, I'm just coming into the kidney world, and because of the family experience, but I feel we can start somewhere. Dr. Kazi-Njema is doing his part on platforms up there, but now this is affecting mostly the local person, the village person who may not even go on X or social media for information. What plans do we have? Like, how are we going to come up with strong awareness, advocacy messages that are going to reach the local person? Who are those people that are willing to come on ground with resources or without resources? I remember the time I started, I would wear plain t-shirts and write HIV positive, and I would walk on the streets of Kampala because I was a street child by then. I would sit in a taxi, switch off my phone, and pretend I'm sharing my story. And then people would get to know about HIV. And that's how I started being invited to schools, to churches, and on media platforms. So there, I believe we can come up with creative ways, and we start this because honestly, this is a lifestyle issue. Our environment is going worse and worse every day. So if we don't create awareness, we are going to get more cases because drug abuse is on the increase. Hoima City, the busiest activities, it's bars and clubs and everything. People are consuming each other rapidly. So I really want to thank you for making this happen. And please, HIV is still around. And as you're in the city, I'm a living example that you don't tell who is HIV positive, because I'm HIV positive and hot. So So you'll find us in the corridors and you start consuming on us. Please don't go back with HIV from here, but I'm really grateful. Thank you so much.
Yes, good afternoon. My name is Dr. Emmanuel Venance, a physician currently based in Fort Portal. My question is not far from the former person, and it goes to Dr. Peace, and specifically her experience and maybe the general experience with HIV patients. One of the things she has said is that one of the key characteristics of a perfect donor would be a twin, and I'm trying to think of it from an angle that the mother had 2 kids and twins, right? And unfortunately, both are HIV positive. Then in the course of life, one gets a renal failure, one the kidney is verified, but otherwise it's only HIV, but otherwise healthy. What is the experience with a transplant and that angle? Thank you.
Thank you very much. So in terms of that particular case, that's a case of HIV infection. So HIV patients can be easily transplanted from HIV positive to HIV positive. Although we've not had an experience with that before, I know in South Africa they freely transplant HIV positive patients without any issues. The only issue that they usually would encounter is drug interactions between the immune suppression drugs and the anti-rejection medicines that they give them. But otherwise, if they're otherwise healthy, no other comorbidities, it's just HIV, viral load is undetectable, CD4 count is within reasonable range, no infections, then there would be no reason to reject such a pair.
Okay, thank you so much. Mine is a small one, maybe I missed it out. My name is Ataya. I didn't get it, Dr. This said the transplant is CAMS. Is there any cost? I know CAMS is supposed to be free. So is there any cost?
So right now, the camps, our intention is to have the camps happen at least once every quarter, so at least 4 times a year. But as you have seen, bringing everybody together, bringing all the things that you need together takes a bit of time. So we've only managed to have, the most we've had is 3 camps in 1 year. And we hope that as the year goes by and people get more experience, we'll be able to do more camps more frequently. And also that our doctors, because there are skills transfer camps. So we have 2 teams. We have a team from Manchester and a team from India who come and do surgery with our doctors to train them. So we hope that as our doctors get more comfortable with doing the surgery and they're able to do it on their own, then they'll be able to do it more frequently. That would be like whenever you need to have surgery, we plan and have it. So right now, because it's a skills transfer period, the surgery itself is paid for by the government, so that's Ministry of Health. It pays for the surgery, it pays for the drugs. The only thing that patients pay for is lab tests, which are not available in the hospital. So as long as the test is in the hospital, in Molago Hospital, they get it free of charge. But if it's not, then they pay for it. Some of the workup things like the echoes, the spirometries, things like that, they'll pay for. But the rest is paid for by government.
Thank you very much for maintaining the interest and energy the entire afternoon.
Thank you. Thank you very much.
That's the last one.
Mine, I think, will go to the whole secretariat of the UKF and probably Dr. Galvo. For the members that are subscribing to UKF, you know, sometimes you try to apply in some places and like if you want to go for further education, and there is always a request to prove that you are a bona fide member of UKF, I think we need to devise means to see how we identify our members. Just like how people have subscribed to ISM, I think we need something that identifies us, because it becomes a little challenging and you can't prove that you're a member, but
thank you for that contribution. On that note, close the scientific sessions and slide into another session, which will be led by our President of Uganda Kidney Foundation, and that's an awards and recognition session.
Thank you very much, our masters of ceremonies. And thank you, everyone. I wish to write on the protocol that has been observed since morning. But let me first thank all of you for such attention. Standing and sitting this side, I've observed how connected you have been this morning, and it's amazing. I don't know if you guys did anything to your food to keep you this alert, but I've not seen this, and I must commend you, and I wish you could clap for yourselves. Please do. And this emphasizes the interest that has grown in kidney disease. 2012, I think these people would the first one in the Kanongo, I don't know how many people went, which means you would go there and talk to yourselves and see us here gathering a ball or a city. And on this note, I wish to commend the assistant RCC of Hoima that has actually been here since morning. We appreciate you. And we wish to appreciate those that have ensured that security has been tight since morning. And on this note, I want to thank Superintendent of Police, Akiza Alan. Yes, it really helps when you have people like you here, because at the end of the day, the one that has the stroke of the pen that makes a decision, you probably know them very well, and we have added 2 senior advocates to Kemigisa, among others. Thanks for joining us and being here with us and helping us push this agenda. And I want to give you good news that Omulodi Mwali, yes, Omulodi Mwali, the Deputy Lord Mayor of Hoima, Oil City, Ms. Sylvia Nalumaka, we welcome you and we thank you very much. And at the opportune time, I will invite you to come and give the awards with us. But I'm so sure that we wish to hear from you, and you also have a message from us. So at this moment, allow me to invite you. First, the Assistant RCC, and then you will take the honor to invite the Deputy Lord Mayor for us. So, Mr. Lingana Davis, I take this moment to invite you.
Thank you, Mr. President. I will not go back into protocol. Let me observe all the protocol. I'm Beingana Davis Nkunda, representing the RCC, who is not around the city, who has some other engagements at the headquarters. I want to thank the organizers of World Kidney Day to have thought of us as Hoima City and brought this celebration here. I want to thank you. Once again, yes, we have learned a lot from what we have been listening to, the presentations, only that we artists at times get lost somewhere when you start talking about your terminologies. But I want to thank again the President of the Republic of Uganda, who is in support of scientists. After I have seen in Uganda we are lucky and blessed, there is no need now of fighting to go abroad because the doctors I have heard and seen here are enough to do everything for us when God is with us. And I will not forget, of course, to thank the President for the peace he ushered in Uganda. That was when he captured power. If it was not to be peace in the country, all these innovations, all these creativities wouldn't take place. I heard Oliver, where is Oliver? Dr. Oliver. When he talked of Rachel, then I remembered those days of God. When he was speaking people there, you could not be standing here telling us good news than we had today. So, with those few remarks, allow me to invite the Deputy Lord Mayor to come and say a word. Thank you.
Thank you, RCC. I'm also going to recognize the protocol already recognized. I'm Sylvia Narumaga Varesimba, Deputy City Mayor. I'm also here on behalf of the City Mayor, who is not in the city because of other engagements. And I want to start by apologizing. I missed the morning session because of other engagements. But we got the invitation in time, and we know we were allotted the time. It's just because of other engagements. But on behalf of Hoima City, I want to welcome everyone in Hoima City, and I want to thank the organizers of this day for choosing Hoima City, for bringing this celebration of World Kidney Day here in Hoima City. To us, Hoima City, it's not just celebration, it has been a day of awareness. And I know even tomorrow we are going to benefit more, because this is very key. To us, it is really a blessing, and it has been a good timing. You had my daughter behind there, Kemigisa, talking about the chewing and whatever. That is Hoima City now, and it is worsening. We have population increasing on a daily basis, a combination of different things. The environment is affected here and there. So this is a good timing, and indeed, the little time I've spent here, I've learned a lot, and I've observed we need more and more engagements. We need awareness of our people, because this is not a simple disease. This is a silent killer, and many people, we may not be knowing that we are candidates. So I want to appreciate you and request for more engagements, more support, that we bring awareness to our people. I got a chance
of visiting our center here, where they are doing that care at Hoima Referral Hospital. Really, it is a work that needs commitment and love. And I want to appreciate the girl I found taking care. And I want to congratulate you, Dr. Immaculate. I saw her among the people graduating today. I looked at her, young girl. I remember that day she even had a sick, think of a kid, a child there, but very, very committed. On that note, I want to congratulate the graduates today. Thank you for that commitment. Thank you for that passion. I know it is beyond, because you give us hope. No, giving hope is cure. No, when you get someone taking care, really concerned, you feel like, now I'm safe. So Immaculate, I recommend the work you did. And the team, thank you for offering yourself to serve in that category. As I said, this is challenging to all of us, the leaders, the parents, the community workers, everyone, because as I said, it is a silent killer. Sometimes we take life for granted. I'm imagining. So we have a challenge nowadays of self-medication. Some of us, we know once you are sick, you gotta buy painkillers. And I heard, I don't know if it is true, that painkillers also can cause such a disease. But now to the community, it is order of the day. We know once you fall sick, you gotta buy diclofenac. Is it pain? You buy diclofenac. Even tomorrow you go back, and the other day you go back. For us, once you're okay, you move. So meaning we need a lot of awareness. We need to give people information, and I believe in prevention than cure, because for sure it is very costly. Someone was calculating here the money needed even in one day. If you do the assessment, few people who can afford. So you end up dying, knowing and accepting that I'm gone because I don't have the money to pay. So thank you so much. I know again RCC now, again it comes back to our challenge also to change the mindset of our people. I know we fear testing. We fear to go for testing. We have a mindset that once I get to know that I have this problem, I have this disease, I'm gone. So it is also another call of changing people's mindsets. We keep checking to see that we prevent or we avoid higher expenses. Once again, I want to say thank you to all the presenters, the doctors. I've been listening. I came earlier, I was in the corner there, following everything. Thank you for the presentations. Thank you for the message. Thank you for the commitment. Thank you for the confidence that Ugandans we can. Because it is confidence. Thank you so much. We just pray for God's guidance, God to give you more wisdom. We do more than this to see that we prevent and cure such a killer disease. Otherwise, I wish you well. I wish you a happy stay in Hoima City. Enjoy. Don't be discouraged of the showing, but you enjoy. We have a number of happening places, and please come again. Thank you for the introduction.
Thank you very much, Lord Mayor. On that note, I will ask. Yes, I'm going to ask the DPC, representative of RPC, Assistant RCC, and the Lord Mayor to kindly step forward here from where we are going to give our awards to people that I do not know this process. And Prof. Kazi-Njema, I would ask you as our boss, that's the word we commonly use in our fraternity. But as we prepare for that, when you meet these people, you pray. So Lord Mayor and RCC, we have prayers. And I'm going to ask Dr. Nyende to stand up. Dr. Nyende here is one of very few people you're lucky to have, but you're using him as a simple physician. Yet you know he's not a simple man. Look, there's nothing simple about him. So, what am I supposed to have at least 3 physicians? The senior consultant, the consultant, then MOSG. You people have flipped the things and put the most senior to make the most junior. So my prayer is you push this gentleman to become a senior consultant physician. He is. He has gone to master. What are you waiting for? Yes. And then the lady you saw there is employed as a nurse. Yes, and your hospital is supposed to have at least 3 nephrology nursing officers. So our prayer is that you push the next time we make a phone call, this thing is settled. That is our prayer, Lord Mayor and RCC. She has announced that the wage has been increased. Thank you very much. I think that's a big step. So I look forward to greeting the senior consultant physician and nephrology nursing officer. Yes. The winner of this award has a name that begins with the S, followed by another letter, and the last letter of the first name is W. Do you want to guess? Distinguished Service Award presented to Sectorico Andrew. For your exceptional service towards promotion of kidney care in Uganda 2026. Andrew Sectorico. Oh my God, that's the problem with surprises. You've seen people slapped when they want to propose. But I think we can, for the photo moment, I know a good friend of his, yes, that is going to represent me. So, please. Thank you. I think I know. Next time I want an award, I'll find myself on the list of MCs because this Distinguished Service Award is presented to come. That's back in the days. She's probably one of the first nurses that's trained. She endured the journey to the lands in the East, PPE, and was the first to train regarding transplant and dialysis. Thank you very much, and thank you for keeping young. I must congratulate you. Yes, this one is so easy because I know there are 3 of them in the country. This Distinguished Service Award is presented to Dr. Awujo Judy Caroline for exceptional service towards promotion of kidney care in Uganda. And I know what Judy actually goes through, the sacrifice that she makes to be present and puts those catheters and dialyze those 15 kilogram babies. You know when you're so small, they measure you in kilograms, not age. Congratulations, Dr. Awujo. Thanks for the leadership you're offering at Makere and Mulago. We appreciate. And thanks for the training, for the mentorship that you're giving. And we pray that your PD program takes root and spreads throughout the country. Welcome. Congratulations. This distinguished service, I think I can give me some favorite names in the what line is this? The Ngabi clan. The favorite name. This name is supposed to be given with Ponata's special duty I learned, so to speak. Distinguished Service Award presented to Betty Muwonge. I think she's represented, she's going to be represented by another award winner. Congratulations to her on our behalf. Thank you, and thank you. Right. All right, so we have to celebrate the end of this with cutting of the cake, and as they prepare to get it here, I want to take this opportunity to thank, and I didn't know so much, I didn't even know I would become one of us, but that is what it is, daring to dream, and we thank God that we now have more dreamers, and we hope that a day will come when we are self-sufficient kidney institute and changing lives, not just in Hoima, but every regional referral hospital. But the greater joy will be when we prevent kidney disease. So I thank you very much. I think at the end, Dr. Nyenge will come and introduce to us the team that he has worked with. I will leave that to him. But let us enjoy the cake. I'm sure we are going to have some representatives from the graduates, and not being so many. I think it would be a very nice picture having all of them here when we are cutting our cake. So please come. Please come, all of you, because it is your day. Yes, and Dr. Magasha. Oh yes, the PhD, you can come and smear some of us with a PhD-ness. Yeah, we talked about this on Twitter. Having nice looks.
The amazing team that we coordinated this. I'd like to appreciate them tremendously. Today was supposed to be the party, and then the Kasiki tomorrow. And we believe in Kasiki, we appreciate the tremendous work that has been done and has been put in. We know there's one person who prepared the party one time in one of the books, and the people did not know. So the king got annoyed and said, you go and invite the beggars to come and attend the party. But we appreciate your time and effort. Please clap for yourselves. Being here from morning until now, we appreciate. And even choosing Hoima to host, it was a privilege and it was a blessing. We don't take it for granted. I would like to appreciate each of the members here. They have tremendous qualities. Mr. Sari is the Vice Chairperson of this 2026 Working Day. And I never saw him getting annoyed. I don't know if he even ever gets annoyed. Because we call him many times, send him a message, he's coordinating, running here, he's been in Hoima, I think almost this whole week on ground, just clap for him. The Vice Chairperson in Hoima took all the graduates. I'm shocked that he's even here. He lost a brother-in-law yesterday. But this gentleman you see here was a vice chairperson and was coordinating things down here where I was not able to. And of course, he works hand in hand with a very active lady, Immaculate, who was formed in the unit. And Sister Donathan is not around, the in charge of the facility. We appreciate the SPM of Sister Achai. Initially, when we were going to do dialysis and during the training, she identified the most hardworking nurses in the hospital to be trained in dialysis. And I think she will testify with me that these nurses here, where they were taken from, there was a deep hole and they felt it. And because dialysis, we want the best. I think Professor Paris will attest to that. The doctors, the nurses are the best in the country. So we have the best brains in the dialysis unit. Mr. Mai, where is Mr. Mai? He's engaged outside. Sister Dong, we appreciate your efforts in running the chronic care team. She's very active, very happy. Another person I've never seen her angry and sad, but we appreciate your efforts. Dr. Bira, she has been our MC. I introduced her to dialysis through one of the doctors that had been trained previously in dialysis. Is now pursuing a master's in obstetrics. So I felt a bit pained, so I called one of my medical officers and I said, I have a slot for someone to train in dialysis engineering. So I called one of our friends and said, this lady, she's just completing internship. Maybe you call her. And I called her, and she was still in internship. She was left with about 2 weeks. So she says, Doctor, I'm still in internship. You call my supervisor. And indeed, I called her supervisor, Dr. Kazi-Njema, and explained and said, please, let her, you can release her for 2 weeks to come and get a feel of dialysis. And I appreciate Dr. Kazi-Njema from Nakuru who released her. And she came. She was heavy actually. She was gravid. But she came and enjoyed this, the training for 1 week, and she was very passionate. At one point, she was managing patients with Dr. Barunji Pius. I think he's in the house. And we appreciate. And she's been running up and down on behalf of Uma Unyoro. She's been very active. Even when the current president was standing, she was one of the chief mobilizers. We appreciate. Thank you very much. And also when she sees the patients of renal fast before I see the master, because of the work I do, I do a bit of administration and clinical, but she sees the patients and we discuss all the patients, and she's very hardworking. Admin is not here, but she was part of us, the senior hospital admin. We appreciate her role. So the Kampala team, Chintu Herbert, I didn't even know you were graduating, a surprise. I was shocked that he was graduating, but we appreciate his work as the admin and coding and all the other aspects. Mark Joey is our public relations. We appreciate the tremendous work and advocacy that you've done for us. Olive, you know how I said you before. I showed you. I said that Olive, very hardworking, very knowledgeable dialysis nurse. That's how I said her before. And indeed, she's been our treasurer, and we appreciate. Who have I talked about? Amina. Amina is the calmness in the team. She's calm and she brings us to speed. Says, when are we having the meeting, people? We are too busy. I'm giving you a venue to attend the meeting. So Amina, we appreciate and we thank you. May God richly bless you. So this is the team that has made this day successful, and please clap for them. We have had many cakes and taken our own cake, but over to you, Mr. President. That's the team you gave us and we did the work. And of course, the support of the President and the Treasurer, Professor Agasha. We appreciate. I know we call you and call you. we appreciate all the support. Professor Kazi-Njema, thank you very much. While I was doing my master's studies, my scholarship for research was because of Professor Kazi-Njema for my master's study. I appreciate him for that. And also getting the McMaster offer was because the person who came to interview me during my thesis liked how I presented myself, and she helped to make it the fellowship of McMaster training. Dr. Ujo was my classmate. I was joking with her, and I said we did internship together, we did undergraduate together, we did internship together, we worked together in the first HIV program, and we didn't know that we didn't do nephrology, but we somehow went together. Thank you very much, Dr. Rose Muhindo. Thank you very much, Dr. Chikuru. Thank you for the mentorship. Thank you very much. That's
we are going to have a group photo. Chair.
They tell us, the cameraman. Where am I going to have?
Group photo for all members.
We stand beside. Okay, all of us.
So we are going to have a group photo in front here for all the members. Then members, those who want to subscribe to Uganda Kidney Foundation, please come and see me. Subscription is 50,000 and we pay every year 20,000